Cholesterol test. A complete cholesterol test is also called a lipid panel or lipid profile. Your doctor can use it to measure the amount of good and bad cholesterol and triglycerides, a type of fat, in your blood. Cholesterol is a soft, waxy fat that your body needs to function properly. However, too much cholesterol can lead to heart disease, stroke, atherosclerosis, a clogging or hardening of your arteries. In particular, if you're a man, you should get your cholesterol levels checked regularly, starting by age 35 or younger. If you're a woman, you should begin routine cholesterol screening by age 45 or younger. To be on the safe side, you may want to get your cholesterol tested every 5 years beginning as early as age 20. When you've been diagnosed with diabetes, heart disease, stroke, or high blood pressure, or when you're taking medication to control your cholesterol levels, you should check your cholesterol every year. Who should get tested for cholesterol? Cholesterol testing is very important if you have a family history of high cholesterol or heart disease, smoke cigarettes, drink alcohol frequently, are overweight or obese, lead an inactive lifestyle, have diabetes, kidney disease, polycystic ovary syndrome, or an underactive thyroid gland. All of these things can increase your risk of developing high cholesterol. Purpose of cholesterol test. A complete cholesterol test measures 4 types of lipids, or fats, in your blood. Total cholesterol. This is the total amount of cholesterol in your blood. High-density lipoprotein, HDL, cholesterol. This is referred to as good cholesterol because it helps remove LDL cholesterol from your blood. Low-density lipoprotein, LDL, cholesterol. This is referred to as bad cholesterol. Too much of it raises your risk of heart attack, stroke, and atherosclerosis. Triglycerides. When you eat, your body converts the calories it doesn't need into triglycerides, which are stored in your fat cells. People who are overweight, diabetic, eat too many sweets, or drink too much alcohol can have high triglyceride levels. Preparation for a cholesterol test. In some cases, your doctor may ask you to fast before having your cholesterol levels tested. If you're only getting your HDL and total cholesterol levels checked, you may be able to eat beforehand. However, if you're having a complete lipid profile done, you should avoid eating or drinking anything other than water for 9 to 12 hours before your test. Before your test, you should also tell your doctor about your family history of heart health, any symptoms or health problems you're experiencing, all medications and supplements that you're currently taking. If you're taking medications that could increase your cholesterol levels, such as birth control pills, your doctor may ask you to stop taking them a few days before your test. The process of checking cholesterol. To check your cholesterol levels, your doctor will need to get a sample of your blood. You will probably have your blood drawn in the morning, sometimes after fasting since the night before. A blood test is an outpatient procedure. It takes only a few minutes and is relatively painless. It's usually performed at a diagnostic lab. In some cases, it can also be performed during a regular doctor visit, at a local pharmacy, or even at home. Walk-in clinic rates can cost anywhere from $50 to $100. Also, cholesterol testing at a local pharmacy can cost $5 to $25. An at-home test can cost anywhere from $15 to $25, while tests that need to be shipped to a lab can average $75 to $200. There are very few risks associated with having your blood drawn for a cholesterol test. You may feel slightly faint or have some soreness or pain at the site where your blood was drawn. There's also a very slight risk of infection at the puncture site. Test results for cholesterol test. Cholesterol levels are measured in milligrams, mg, of cholesterol per deciliter, dl, of blood. Specifically, ideal results for most adults are LDL, 70 to 130 mg per deciliter, the lower the number, the better. HDL, more than 40 to 60 mg per deciliter, the higher the number, the better. Total cholesterol, less than 200 mg per deciliter, the lower the number, the better. Triglycerides, 10 to 150 mg per deciliter, the lower the number, the better. When your cholesterol numbers are outside of the normal range, you may be at a higher risk of heart disease, stroke, and atherosclerosis. Of course, if your test results are abnormal, your doctor may order a blood glucose test to check for diabetes. Moreover, your doctor might also order a thyroid function test to determine if your thyroid is underactive. Cholesterol test. Can test results be wrong? In some cases, cholesterol test results can be wrong. For example, a study published in the Journal of the American College of Cardiology found that one common method for calculating LDL cholesterol levels often produces inaccurate results. Improper fasting, medications, human error, and a variety of other factors. They can cause your test to produce false negative or false positive results. So, testing both your HDL and LDL levels typically produces more accurate results than checking your LDL alone. How to treat cholesterol. High cholesterol can be treated with lifestyle changes and medication. In particular, lowering high levels of LDL in your blood can help you avoid problems with your heart and blood vessels. To help lower your cholesterol levels, quit smoking tobacco and limit your alcohol consumption. Avoid high-fat and high-sodium foods, while maintaining a well-balanced diet. Eat a wide variety of vegetables, fruits, whole grain products, low-fat dairy products, and lean sources of protein. Exercise regularly. Try to do 150 minutes of moderate-intensity aerobic activity per week, as well as 2 sessions of muscle-strengthening activities. Your doctor may put you on a therapeutic lifestyle changes or TLC diet. Under this meal plan, only 7% of your daily calories should come from saturated fat. Moreover, it also requires you to get less than 200 milligrams of cholesterol from your food each day. Some foods help your digestive tract absorb less cholesterol. For example, your doctor may encourage you to eat more oats, barley, and other whole grains. Vegetables such as eggplant and okra. Fruits such as apples, pears, bananas, and oranges. Beans and legumes, such as kidney beans, chickpeas, and lentils. Obesity is also a common risk factor for high cholesterol and heart disease. So, your doctor may encourage you to lose weight by cutting calories from your diet and exercising more. Taking medications such as statins can also help keep your cholesterol in check. These medications help lower your LDL levels. Advice. Overall, high cholesterol is very manageable. Ask your doctor to help you create a treatment plan that you can maintain. It may include changes to your diet, exercise routine, and other daily habits. On the other hand, it may also include cholesterol-lowering medications. Of course, the more proactive you are in making lifestyle changes and taking prescribed medications, the better results you will have. Reference: The One Food Cholesterol Cure. 2 months free solution. Or visit 247naturalhealth.com to all chronic illness information. Link in the description. In particular, if you know Qigong and its miraculous improvements to health, visit falundafa.org. Thank you. I hope you are always happy and healthy. Thanks for watching. Don't forget to subscribe to the channel to receive useful information.